My name is Kathy Hecker. A few months ago, I had some episodes of severe dizziness. My eyes popped open one morning, and it felt like when I opened my eyes that they rolled back in my head, like a severe, very rapid spinning. We went to the emergency room first, and a couple doctors, and was referred to a local physical therapist that had some background in treating what they finally diagnosed as vertigo. I probably had about 5 weeks of going to the doctor, 2 emergency room visits, and actually an ambulance ride once, and eventually finishing a course of physical therapy. And the physical therapist that I ended up going to for about 5 weeks would look some things up on the internet and would try some different maneuvers and send me home with some exercises, and ended up really one day just saying, and this was about after 5 weeks, he said, "I really don't know what to do with you." Well, my husband was then seeing a therapist here at Sheridan Physical Therapy, and somehow they got on that topic because he'd been carting me around. I hadn't driven for 5 weeks. My husband came rushing home and he said, "You have to call them, you have to make an appointment." And so I came in here, and the therapy was vastly different because it involved some technology that the other office didn't have. And after the first time I came here, I have really never had another spinning attack.
My name is Cheston Feaster. Most of my patients call me Chet. I am one of the co-owners here and a physical therapist, and I have a special interest in vestibular rehab. So when people are experiencing dizziness, we often think of the inner ear as being a possibility of what's causing their symptoms. And the inner ear is actually quite complex, and there are many different kinds of vertigo. So this makes it imperative that we perform the most accurate assessment so we can provide customized treatment. The most common cause of dizziness or vertigo is something called benign paroxysmal positional vertigo. It's referred to as BPPV. What this means is it's benign, so it's not harmful in a sense. It's paroxysmal, so it comes on without reason. It's positional, so with different positions you can experience this, and it brings on vertigo, so you feel like the world's moving or you're spinning. And with a BPPV, there's debris that should normally be in your inner ear, but that debris gets dislodged and it makes its way into a semicircular canal, is what it's called. So your inner ear has 3 different circles, half circles attached to it, and in these circles is some fluid called endolymph. So when you move, that fluid moves and it tells your body you're moving. If you can imagine being on a merry-go-round, you're spinning, and you get off that merry-go-round and you still feel like you're spinning just for a few seconds, and that's your endolymph just continuing to circle until it stops. So with BPPV, that debris that's in that canal moves, kind of stimulates that endolymph to move, and it stimulates the hair cells within that canal and tells your body you're spinning, you're moving when you're not. So the treatment for this is quite simple, actually. If you do a very accurate assessment and you're confident this is what's going on, then to get this debris out of there is a series of rolling maneuvers. And there's lots of different rolling maneuvers, and they're specified for different canals. So you have to make sure you're working on the right canal and you're performing the right maneuver, but your goal is with rolling and moving that debris around, you get it out of that canal where it should not be and back into the spot where it should be. So when Kathy first came to see me, she had a diagnosis of BPPV, but she had had some treatment for a few weeks and was experiencing no relief from her dizziness. So after our first visit, we knew it was lateral canal, so we knew the treatment she had been doing was not effective. We did a repositioning maneuver for the lateral canal, and after one visit, she was feeling a lot better. We used infrared goggles to assess, her eye movements while trying to provoke her symptoms. These goggles allow me to block your visual fixation, so we get the most pure form of your nystagmus, or those eye movements. This is considered the gold standard when assessing positional vertigo. And so we're very fortunate to have these goggles, this technology here at Cheston Physical Therapy. So here we have Kathy, we have the infrared goggles on her. What we're going to look for here is we turn her head to the right. I'm watching her eyes, see if we have any involuntary eye movements. Nystagmus is what it's called. And we see just a slight bit of ticking, and it's very horizontal in nature. And this is distinctly different than our typical posterior canal that's very common. So right away I'm thinking, okay, this seems like it's probably a lateral canal BPPV. So the other thing we're going to want to see is when we go to her other side, we want to see that nystagmus be reproduced again, and it should be in the opposite direction that it was the first time. As we get over there, we do start to see some mild ticking that's going to get a little more severe. Now Kathy's feeling very dizzy right now. She's feeling like her world's spinning around. And that's exactly what we wanted to see to confirm that is a lateral canal BPPV. I performed a cannulate repositioning maneuver with Kathy on her first day. I also had her do this at home. She came back a week later, said she had not had any dizziness. So we always like to go ahead and recheck both sides. As you can see, checking her right side, no nystagmus, she felt good. We also go ahead and check the left, same thing, she's feeling good, no nystagmus. This to me tells me that our treatment was effective, and her chances of this returning are quite minimal.
I highly recommend this treatment. Anytime I hear anybody that thinks they might have this or had it, or I say if you ever have it again, to check this out, and that there aren't very many places even in our state. So I hope that the word is getting around, and I hope that other people can have as good of experience of taking care of their situation.
If you or someone you know is experiencing dizziness or vertigo, I just encourage you, talk to your doctor or come see me at Cheston Physical Therapy, and we can do an assessment. We can see if what you're experiencing is something that can be helped with physical therapy.